Hi, everyone. I'm Silvan, and you're listening to the Silvati's podcast. So, on the podcast, I've got an osteopath and a dear friend of mine, Alex Calamaro, joining me. We're going to be talking about gastric bypass. So, thank you so much for joining me today, Alex.
Thank you for having me. I've watched a lot of your podcasts and I'm a huge fan, so thank you so much for having me.
Thanks. I never know who's going to be listening or watching this, so it's always nice to hear that people are engaging. It's sort of affirming for me. But one of the things I really wanted to get you on the podcast on was to talk about gastric bypass. Now, I know this is something that's become a little bit more common knowledge sort of in the public, but I feel like there's still some misconceptions and not a lot of information out there. Now, I understand that you had a gastric bypass, and that's the majority of what we're going to be talking about today. I wondered if you sort of if we can just start from the beginning and if you can just tell me sort of what led up to having the bypass.
Yeah, of course, really happy to share my story. Um, so I had a gastric bypass, in July 2019, so some years ago, and it has drastically changed my life for the better, physically, but mostly mentally as well. So the reason why I actually opted for the surgery was my weight was just spiraling out of control. I actually maxed out at 141 kilos. For people who don't use kilos, it's I'll say it in pounds and stones. So it's 311 pounds or 22 stones, which is quite some weight. And the reason why I actually opted for the surgery was when I was a teenager, I was always bigger. I was always bigger and stronger, but also quite overweight compared to my friends, compared to everyone else, to the school I went to. And with that, I actually did a sport that I still love, that I can't play anymore because of injuries, but I still follow religiously, and it's rugby. So by the age of 15, I started playing rugby, and I'd say not because, but thanks to my size, I was playing prop. So for people who don't watch or know anything about rugby, it's they are considered to be the fat guys in the team, so the strong guys who do all the dirty work. Um, and It was a lot of fun. Unfortunately, I had to stop playing because I had two major injuries. So two whiplash incidents, which were pretty nasty, and add that some blackouts, some concussions as well. So yeah, it wasn't great. And by the when I decided to stop playing rugby at the age of 23, so I'm 28 now. So when I stopped playing at the age of 23, I the lifestyle of a rugby player like myself just continued. So unfortunately, I lost all motivation, determination of going to the gym to build myself to play rugby, but my eating habits were still present. So I was eating 4 or 5 meals a day, which is a lot. Even though I love food, still love food. It was still a lot, and my weight just spiraled out of control. And like I said, I just maxed out at 141 kilos. Even though when I was a teenager, I was trying to control my weight. Seeing nutritionists, seeing personal trainers, going to the gym, etc., just gaining knowledge, but it never really happened. So the reason why I had that bypass was I knew someone else who had it as well, and it actually changed their life also for the better. So that's why I opted for surgery. Yeah.
Yeah, and just hearing you talk about it, I mean, it so resonates with me as somebody who has struggled with their weight
Yeah.
continuously since I was a teenager. And I think that story, a lot of people would have experienced, trouble, you know, mainly losing weight. I suppose there are some people who have, problems gaining weight as well, and that's a valid thing as well. Um, I'm wondering sort of when you decided to have it done.
So I had the surgery in 2019, and I think I decided to have it a year before. Uh, my decision was made so in during the summer of 2018. Um, Obviously, summer break, had a lot of time to think about it after passing the exam, etc. Just deflating after that BCom year. But yeah, I had a year of thinking about it, of planning everything because I had the surgery abroad, and it was one of the best decisions I took so far. So absolutely, yeah, it was a long time to think about it, but I know I made the right decision.
Yeah. And just to preface, so you had this done when you were still doing your undergrad master's and degree at BCom, so the British College of Osteopathic Medicine. In fact, that's how we know each other because we studied together. Um,
Correct.
so, you decide to have this done over the summer break in between the academic years, and then you come back. Now, that to me feels like a lot on top of the rigorous study schedule that is BCom because we've all been there. Thank God we all graduated. Um, some people didn't, I'm just saying. Um, but that feels like a lot to take on.
Yeah.
Um, I'm wondering what actually they do in a gastric bypass. Like, because I've heard there's different options you can have as well from what I was reading. There's the gastric bypass, there's the band and the sleeve, and so there's a lot of information out there. And sometimes it's to me it was a little confusing.
Yeah, correct. I don't know why I had surgery between the third and fourth year. I think I was just, in a way, quite desperate, but I was so happy to have it that I just wanted to have it. And thankfully, I actually recovered really quickly. The surgeon who operated on me told me that I needed between 2 to 3 months of just recovery, and I actually managed to recover in a month and a half. So I was actually ready to get on with my final year. Um, but for the gastric bypass, so the umbrella term is called bariatric surgery, and in that you've got different surgery. So you've got your gastric bypass, which I had, your gastric band, sleeve, etc. So the bypass is actually just a full-on bypass where in the gastrointestinal system you've got your mouth esophagus, your stomach, and then your small intestine, which is divided into three areas. So as you digest food in your stomach, then it's passed on to your small intestine where most of the nutrients are absorbed. For what happened to me was they cut the upper part of the stomach, still connected to the esophagus, and they bypass it to the second part of your small intestine. So the rest of the stomach and the first part of your small intestine are still there. Then they don't remove it out of your body. It's still there, but they still bypass it. So they bypass it. That's why. So in terms of physiology, the food is digested into the stomach and then it's passed on to the nutrients. For me, everything takes place in one area. So that's why everything takes longer for me to process everything. I eat less and the food portions are reduced. That's why further, during the time I just lose weight. So that's the whole idea. And thankfully, they managed to do this kind of surgery because the walls of the small intestine are powerful enough, are strong enough to sustain the acidity of the gastric juices. Because otherwise, it would be impossible, and I'd be burning from the inside, which wouldn't recommend. But it was actually so it's a keyhole surgery. Thankfully, so they don't have to literally open me up, and thankfully for technology nowadays, yeah, it was quite interesting. I think the worst part was the I'd say the first week post surgery. Yeah.
So it sounds like it's quite an invasive surgery, really. If you think about your GI tract, it's huge, essentially,
Yeah.
and it's such a huge component to how we are and how we metabolize food and digest. And so it sounds like for the operation that you had, it's sort of just almost literally, I hate to say the same word as bypass, but it literally just connected one part of your body to another. And essentially, it sounds like it reduced your portion sizes and it sort of slowed it down in a way. Is that right?
Absolutely, yeah. It's like you said, you literally change the anatomy of your gastrointestinal tract. But the thing is, as well, it's actually reversible. So I'm actually able to, I don't know when, if or when I'll do it, because so far I don't really need to go back and have it reversed. But yeah, it's a major surgery. I don't still to this day I'm still trying to put myself back in and realize what I've done, but it's hard because I'm just so happy right now and I just want to get on with it. But yeah, yeah,
Yeah.
yeah, yeah.
How does that change the way you eat, for example?
So thankfully, throughout the since I think the first year, the first 2 years were quite tough because I couldn't enjoy a lot of food compared to now because my body was still trying to understand and process the some foods. So, for example, I can't really eat ice cream to this day because of the whole mixture of sugars and also dairy products. Bearing in mind, unfortunately, I do have dairy and gluten intolerance, which is as a Frenchman, it's probably the worst thing you could have. It is painful, but it was really tough, and unfortunately, you do suffer the repercussions. So just regurgitating, basically, a lot. Yeah. So in terms of really, fatty food, spicy food, just really, even processed foods, anything like that, that takes a lot of effort for your gastrointestinal tract and your whole body to process. It's quite tiring. Um, but thankfully now I'm able to eat a lot of foods I used to enjoy before the surgery. Still, some foods I can't quite eat yet because one, my body uh, doesn't want to, or can't really process it yet. Like for instance, ice cream. And to be fair, I don't miss it that much. And some of the foods I just didn't like before that I don't eat because why? And but so far in general, I can go out and have a meal with my friends without any issues, and I don't have any repercussions. So yeah,
And so what I'm super interested in, obviously mental health is huge in my background and on the
absolutely.
podcast. What does that do to your relationship with food? So now, your portions are a lot smaller. There are some foods that you can't eat, some of which you miss and some of which you don't. But what does that do with your relationship with food from a mental health perspective?
Absolutely, yeah. For me, food was, and actually, I believe it still is my stress reliever. I do eat when I'm stressed. Tend to grab, the first thing that's in the cupboard. But because I had the surgery, I'm actually much more aware of the repercussions of how my body is going to react. Um, so it was really tough at the beginning because it wasn't a punishment, but I could, I could feel and I could, definitely experience that my body wasn't happy uh, post the first couple of months and actually first year after surgery, post surgery. But now, mental health has been better than ever. So for sure, yeah,
And so you go through this really major surgery. Um, And then from what I know, we've had conversations about this, but then you undergo a second procedure. So I wonder if you can tell me a bit about what that entailed and why that came about.
Yeah, absolutely. So the second surgery, I actually had it last summer. So summer so 20 oh yeah, summer 2023. Sorry, I got mixed in the years there. So I had another surgery in 2023, end of July 2023, because in the end, thanks to the gastric bypass, I actually lost 52 kilos, which is, I'd say, quite a substantial amount of weight.
That's a very large amount of weight. Absolutely.
Yeah, it's a lot. And it's actually incredible how much weight the body can endure and sustain and carry. It's actually incredible. Um, but the going back to the second surgery I had, so it's called a abdominoplasty, where because I lost so much weight, I actually had a excess skin flopping in a way, flopping around my mainly my abdominal area. Thankfully, I didn't have anything else, any excess skin anywhere else compared to, I don't know, for example, the chest area or even the arms or the thighs or anything like that. So it was only the abdomen, so lower part of the abdomen. And essentially, they cut out that excess skin. I believe it's quite common in women post pregnancy. Some of them, because of they carry, a child in them, and with the excess skin, essentially they have to cut you open, and then it's almost they have to cut all the way up around the chest area. It's almost pulling everything down, and they cut that excess skin. And because they have to cut all the way up and pull everything down, they have to it's almost relocate your umbilicus as well. So it's actually because it's related to the skin. For me personally, it was way more invasive and way more uncomfortable and painful compared to the first surgery. Even though I'm in I was in general anesthesia, under general anesthesia. Sorry. But yes, it was a major surgery. Actually, still feeling some tension in the area. So it's essentially having a massive smiley underneath your umbilicus. So it's quite a long diameter. It's almost so the sky will be there, but it's almost getting attacked by like a massive animal because you've got massive line scar tissue right there. So the it was quite an experience because I couldn't move for 2 3 months. I had to wear the first month. I had to wear a belt, like a brace, where I had to keep all the skin quite tight because otherwise the surgery, the scar tissue and the rest of the abdomen would just go back and just loosen up basically. So that wasn't fun. Yeah, it wasn't fun at all.
Yeah. And so, how long was it when you had the second surgery? Like, how long was it between the gastric bypass and the abdominal? I can't remember what you said.
Abdominoplasty. So I had the bypass in July 2019, and I had the abdominoplasty in July 2023. So
So it's a
4 years
few
apart.
years.
Yeah.
And so, was that something that you were expecting, or was that something that they had talked about beforehand? Or
Um, it wasn't something I was expecting. I wasn't actually expecting to lose so much weight. It was actually quite incredible, but also to the fact that to have that excess skin, I wasn't really expecting that as well. Um, and I mainly did it because of my silhouette, the physical appearance, basically. It was just bothering me. But the other thing that was really bothering me as well was at work. I could really feel that excess skin. As an osteopath, obviously you're just moving around constantly, treating, using your body like they taught us at BCom. Yeah, it wasn't fun because I could really feel that skin flopping around. Even if I'm treating for example lumbar spine, you have to reach over to to treat, and I could really feel it's almost my skin was getting stuck and impinged on my belt and the scrub as well. It was really, really uncomfortable. It wasn't fun. So that's why I actually, started to do some research, asking questions about people who had that kind of surgery, not because of gastric bypass, but for other reasons. And yeah, that's why I decided to also opt for the surgery. And honestly, so far so good.
Yeah, and it's certainly a aspect of the sort of journey that you don't get to hear a lot about. And even when we were talking, I was quite surprised when you told me, and actually saw the scar, and it was quite, eye-opening. I suppose from what I'm hearing is you've gone through this physical transformation over the last few years, but also your body image has gone through a huge transformation.
Yeah, absolutely. You're spot on. Absolutely. Yeah, it was a major physical transformation for me. The things that made me laugh a lot is my friends, family members who saw me before the two surgeries, and now they see me, and people at BCom, not even my friends, colleagues, but the tutors as well. I still remember when I came back. Obviously, we both had Mr. Nono, so Lazarus, as a tutor, and I still remember the first time he saw me post surgery, and we just had a massive laugh. It was really, really funny. So I walked in the clinic reception, and he saw me, and sorry about the impression, but he saw me as like, young man, you've lost some weight. So we had just a massive laugh about it, and it was fantastic. And other tutors like critique, just massive hugs, and you guys as well. Different years, different whole lot of friends in different years. They saw me. It was really, really fantastic thing. Even still to this day, I still get a lot of smiles and a lot of surprises as well. But I'd say for me, the biggest transformation was the mental aspect,
Yeah.
because you know I was so when I had the bypass, I was 23 years old and maxing out at 141 kilos, and you're a student studying osteopathy. You're mainly there in the future to promote health, well-being, and movement. For me, it was just not possible. It was more than irony, because you're some bloke, trying to promote all of that, and you're weighing 141 kilos is just not possible, to my opinion. So in the end, um, yeah, it was fantastic. And before the surgery, my mental health wasn't good at all. Very toxic to be around. I wasn't the happiest person. I was hangry all the time, so angry and hungry all the time. If I didn't eat food, I was just not happy at all. I was just because food has always been my comfort stress reliever. So yeah, it wasn't fun. And when I went all through the whole process, it was almost I was being reborn. So yeah, absolutely, yeah, yeah, yeah.
Yeah. And what's interesting about that is because a lot of people who aren't osteopaths perhaps don't know that a huge component of our learning is done practicing on each other. And often that involves us taking a lot of our clothes off. We keep underwear on, just for those who are wondering. But essentially, we're practicing on each other in underwear. So you're very exposed. And I can only talk about my experience, but I felt hugely vulnerable being in those technique classes, Um, at the time, I remember I was a lot smaller and weighed a lot less than I do now. And even then, I felt really sort of like cagey about. And I guess it's always that first week where, they tell you, okay, now take your clothes off and start practicing. And everyone just sort of like stands there like, what? And I remember you being in the class, and I think you had prior experience, and so you were the first one to sort of like volunteer to be a body and things like that, and that was such a huge relief for some of us, especially for me, because I was like, okay, cool, it's fine. But yeah, just being in those technique classes for me was hugely anxiety provoking. and actually for me sort of perpetuated me sort of gaining weight and losing weight and gaining weight and losing more weight during the course, trying different diets, exercising to literal fatigue, because you know that you're essentially stripping down on literally a daily basis because we had OT most days. And so I'm wondering what that was like for you in terms of sort of before the surgery and then after losing weight. Did that change how you approach some of those classes at all?
I think, yeah, it definitely changed. At the beginning, pre-surgery, I was so angry and toxic all the time that honestly, I just didn't care what people thought about me. I knew I was not severely overweight. I was morbidly obese. Let's be frank. I was morbidly obese. I just didn't care what people thought about me because I knew I was so angry. I just didn't care. But post surgery, it was a different story because people, I'd say, were a bit more open. Talking to me, approaching me in general, and talk about also how I transformed, but also it was really tough to to work on me because I was just so big that some techniques you can use because of the weight, because of my size. For example, if we were practicing thoracic spine HVT supine, just because of my size and weight, some people can wrap their hands around and apply the pressure. I had to be prone, and then they had to drop the couch all the way down and use their body weight to do the technique. So it was yeah, it wasn't fun, but looking back now, and by the end of third year, everyone's just in the OT class. No one cares. Everyone's running around practicing topless. It's everyone's so comfortable between each other. Yeah, it was a massive transformation. Yeah.
Yeah. And does your head catch up at the same rate as your body changes?
No,
Okay.
no. For me, now it's fine, but sometimes it's mainly people reminding me what I've been through, what I went through, how they saw me before, but also I've got some pictures before the surgery, and deep down I'm telling myself, how dare you? How could you've let this happen? How dare you abuse your body in a way. So I was really critical of myself. It was really tough when I see pictures before the surgery. Essentially, you can even see my neck and it was almost like I was a puffer fish, basically. Um, but yeah, it was really dramatic. Honestly, it wasn't fun. But yeah, like I said, massive transformation was the mental side. I'm just, really just bubbly and happy and just how to, really happy to help people around. I can even do some movements I couldn't even do before, like press ups at the gym. I had to do press ups on my knees before surgery. Now I can do all kinds of press ups and it's a lot of fun. Just basic movements like that. And yeah, it's something else.
Yeah. And so when you have that surgery, do they advocate any type of therapy alongside it, either
Yeah.
before or after? What's that like?
So they really push you, and it's not they don't push you. It's they tell you it's mandatory to do a lot of mental work. Go and see before and after the surgery a psychiatrist. Is it psychiatrist?
It depends on the country. So some places will be psychiatrists, some places will have
Yeah,
clinical psychologists and bariatric surgery. So
yeah,
it really depends.
that kind of stuff. Exactly. So I was seeing one before the surgery, and after the surgery, I just didn't want to because I was just so happy and just wanted to get on with it. But it was mainly my parents, no, you need to go and see someone just, because it's procedures. Like, oh, fine, fair enough. And the sessions were, some of them were helpful just because I was just constantly smiling and I was just so happy all the time that, I was just sharing my happiness with the with the professionals. So yeah, it was something else. And also, actually the day of the surgery, I know a lot of people get nervous. and I was shaking. I was so I was shaking a lot because not because of nervousness. I was so happy and relieved I'm getting that surgery because essentially I was just reborn again. Obviously, thankfully, the surgery went really well. Uh, but the sheer excitement of of having this surgery was just incredible. Yeah,
Yeah,
shaking because of excitement before having surgery for me was just the weirdest concept. I didn't even know it could happen, but yeah, I was just not nervous and scared at all.
yeah. And do they talk about sort of relapse or relapse prevention, um, or
Um,
gaining weight back and things like that? Either,
yes.
yeah,
So there's a lot of there's some severe repercussions that can happen. So one of them being dumping syndrome, where the um the person who had the surgery just doesn't change their lifestyle, and they don't regain the weight directly, but they will have severe repercussions where if they continue with the same lifestyle they had pre-surgery, the amount of times they will regurgitate, and it obviously it's a massive, it takes a massive toll on your body. So thankfully, I didn't have any of that. I did have, unfortunately, I did have two severe episodes of internal bleeding, but that was because of ulcers forming in my stomach, um, because my body was still trying to adjust to the surgery, and I believe there was an over secretion of the gastric juices in my stomach. And with that excess of gastric juices, they were essentially chewing the inside of my stomach. And unfortunately, with the stress, with the work I was doing after graduating, it was there was a lot of stress I had to endure, and unfortunately, at some point I was bleeding from the inside. I had to go to hospital again for not the great for not the greatest reasons, and I actually stay there for almost a week under surveillance, to get rid and cauterize all those ulcers. So yeah,
yeah.
but in the end, yeah.
Yeah, I suppose it's what I'm trying to sort of convey is that it's it's not a in and out thing. It's not a quite an easy thing. There are medical complications. There are instances where it can go well, it can go badly. What I'm trying to say is that it is a big procedure and it has lots of components and lots of sort of facets um, to it. Now, it sounds like you had quite a good experience. Is it something that you would recommend?
I wouldn't say it's something I would recommend because I've had it. It went really well. But it's like you said, it's a life-changing experience and surgery. Even though it's reversible, it is life-changing. If you do not change your lifestyle, if you don't listen to the recommendations of the professionals, you will have severe repercussions. Um, and it's not something to to take lightly.
Yeah,
It's life changing. It takes a lot of work um, on you, a lot of personal work, whether it's physical and mental. And it's something that you need to think long and hard about it. Yeah, absolutely. So it's I wouldn't recommend anyone to go. I believe you need to do that kind of surgery. I can share my experience and my thoughts about it, but that's it. I wouldn't recommend someone to go and say you need to do that surgery because first of all I'm not an expert in it. Even though I've had it, I don't. I'm not an expert. I don't operate on that kind of stuff.
yeah. I think it's just
But
been
yeah,
so helpful to hear your story and to share your story. And I'm really thankful for you to be coming onto the podcast to share that because it's something that I've been interested in listening when we were talking. And I'm like, more people need to hear about this. So thank you so much.
and thank you so much for having me and for letting me sharing my story. It's fantastic. Thank you so much.
Yeah. And where can people find you on social media if they want to get in touch or they have more questions? Because I won't
Yeah.
be able to answer them.
Yeah, of course. So I do have a professional Instagram account. Um, so it's Alex, uh, my surname without the uh, vowels, so Clmro, osteopathy.
Okay, I'll link it below so people can sort of
Yeah,
they can find it. But yeah, thanks for hanging out with me for an hour today, and
thank you so much.
hopefully we'll get to chat a bit more.
Yeah, absolutely. Yeah, thank you so much, Silvan.
Thanks.